Welcome, welcome. Today we have with us Scott Bruder. Can you just introduce yourself real quick?
Yeah, I'm a physician assistant. I work with Dr. Marshall at Lone Peak Orthopedics. That's a HCA hospital in Draper.
Perfect, sweet. And today the purpose of this video is to kind of go over the different questions people have about knee and hip replacements. So thanks for being with us, Scott.
No problem.
So let's just go right into the first question here. The first question is, what symptoms or signs indicate that a hip or knee replacement might be needed?
Yeah, good question. So most of the time, it's usually pain related. There can be some instability with the joint, whether it's a knee or hip. It feels like it gives out or doesn't work correctly. Usually people have a lot of swelling, stiffness, but majority of the time it's pain related.
Totally, perfect. And what are the different types of hip and knee replacement surgeries, and how do each of them differ?
So if we break it up to, I would say, hip replacements, typically there's two different approaches. You have an anterior approach or a posterior approach. That's kind of surgeon preference on how they enter the joint to replace it.
Okay.
Anterior has become a little more popular lately. It's usually muscle sparing, so you don't have to remove any muscles from the bone. You just kind of separate them to get into the joint. Posterior approach is usually from the back. You do have to unattach some of the muscle and tendon attachments to get into the joint and then repair them afterwards. Knee replacements are pretty straightforward. They're usually just through the front of the knee itself to replace the joint. And then depending on what instruments or implants doctors are using, that varies a little bit, but not too much.
Totally. Sweet. And can you walk us through the surgery process, like what a patient can expect the day of the surgery?
Yeah, so usually they get to the hospital, obviously they check in, nurses bring them back, they get into their gown, if they're ready, they get their IV going, they do all their checks as far as their name, allergies, any of that stuff, if they've eaten or not, all the pre-op stuff that they need to go through. Typically in our setting, I meet the patient in pre-op also with Dr. Marshall. He verifies we're doing the correct surgery, we have to mark the surgical site, and then I usually go over any questions they have regarding the surgery, their stay in the hospital, their discharge, and what happens at that point.
Awesome. Are there risks or complications associated with those surgeries?
Absolutely. It's a pretty big surgery. Some of the biggest risks that we see are going to be infections, can happen with any joint replacement because you're going through the skin into a joint. Blood clots are also a big issue with these kinds of surgeries. You can have fractures putting implants in during the surgery. We try to avoid that, obviously.
Totally.
There's also pain issues. Sometimes people don't get 100% relief from pain even after a joint replacement. It's metal you're putting in their body, and sometimes they just don't quite adapt to it. So those are typically the main complications or problems that can happen with surgery.
I know this definitely differs from patient to patient, but how long does the recovery process typically take, and what does it all involve?
We usually tell patients to plan on about 3 to 6 months for full recovery, sometimes up to a year, depending. Some of it depends on just their body style and their overall health. Some of it depends on how bad the arthritis is. Some people heal up quicker than others in life. So it varies from patient to patient. Most patients, we get them up and moving pretty quickly though to start the recuperation process. Usually by 3 to 6 weeks, they're feeling like they're doing well enough. They're kind of getting back to normal activities in life. 3 months to 6 months is probably where they notice it more, that they're doing things that they kind of wanted to do and maybe couldn't before.
Perfect. Yeah, no, that makes sense. Kind of within that, what role does physical therapy play in recovery, and how soon after surgery should they start doing it?
So if they're staying in the hospital for a day, we obviously have hospitalists or therapists in the hospital that work with them while they're there. Therapy is a very important part of it. You're going through a major surgery and you want things to work again, and so a lot of people think they can do their own exercises when they actually really need some help, guiding them, teaching them, showing them how to do stuff, and helping them through that. And so we get therapy involved right away, especially with knee replacements, getting movement, strength, balance, all that. Hip replacements too, with balance and strength and moving. So it's very important. We try and get it done at least 3 to 4 times a week within the first few weeks. We kind of push it really early to get it moving.
Awesome. Well, that's great. Are there any lifestyle changes or activities that someone should avoid after a surgery?
So after joint replacement, they're not really meant to pound on. You're putting metal into a bone, and if you keep, repetitively putting a lot of pressure through it, it can cause problems with the implant or with the bone itself. We do encourage activities, so biking, swimming, walking, exercise are all great activities for joints to keep them moving, and those do well. But obviously high impact stuff is not recommended. And then obviously dietary changes if needed, stopping smoking, things like that are also very helpful for healing and just overall health.
Perfect. What advice would you give someone for preparing mentally as well as physically for surgery?
Physically preparing is probably easier than the mental side, especially if they haven't gone through any kind of surgery before or major surgery like this. But physically, anytime you can get good range of motion or even improve strength with a joint, it's helpful. If you go into a surgery and the joint's very stiff, you can actually come out worse. So we really push for even some pre-therapy sometimes with some of these patients, seeing a therapist and getting range of motion or strength of the knee or a hip prior to a surgery. Sometimes that's not always possible. Mentally, we just try and remind them that it's not going to change overnight. Yes, their arthritis pain may be gone, but obviously they'll have surgery pain, and it's a process. They'll have peaks and valleys, they'll have plateaus where things don't go maybe the way they want, but just to give it time needed for healing, and they should get there.
Yeah, so just more than anything, just being patient.
Yeah, being patient with it,
Totally.
which is hard.
Yeah, no, you want to, well, surgery's done, let's go.
Yeah, that's probably the harder side of it.
Yeah, totally. How long does a hip or knee replacement typically last before it might need a revision?
Literature says anywhere from 10 to 20 years is kind of the time frame. So yeah, depending on what age a patient is when they have an initial joint replacement, their body style, obesity, activity levels, medical problems can all affect that. But probably 10 to 20 years is average, and then you might need something replaced within that joint, whether it's the plastic piece that wears out called the polyethylene, or if the metal components start to come loose from the bone, then those have to be replaced. That's a little bigger surgery. And
Yeah, no, that's pretty intense.
yeah.
Totally. Are there factors that could impact the longevity of a replacement, like the activity level or the weight, kind of like you had mentioned there?
Yeah, they can definitely affect it. We had a patient recently that struggled with weight, ended up having bariatric surgery, lost 115 pounds, and even after knee replacement, felt much better with that amount of weight not going now through the knee replacement. So anytime you can keep weight, your BMI, your body mass index in a reasonable range, activity level definitely helps, I think, keeping those tissues moving, and obviously controlling diabetes, stopping smoking, those kinds of things are definitely better for you overall.
Totally. Awesome. Are there alternative treatments or less invasive options to consider before doing a full-blown knee replacement?
Yeah, so sometimes we'll find patients aren't really good candidates for surgery. It's a big risk on their health overall, their heart and lungs, their brain, different things. And so other options instead of a joint replacement can be injections. You can do steroid injections into a hip, a shoulder, or a knee. We can also do hyaluronic acid injections, which kind of lubricate the joint and can help. Sometimes we've had patients that's their only option, that surgery is not a good option for them, and that's what they use to try and decrease pain, improve function, and be able to do things in life.
Totally. And then the last question we have for you today is, what should a patient look for when choosing a surgeon for this procedure?
That's probably a little more challenging. Obviously, I think you have to be comfortable in meeting them, maybe their team. We have a pretty good team approach with Dr. Marshall, myself, our medical assistant, and then some of the companies we work with outside of the hospital. A lot of people feel like they're always being cared for because of that team approach. So I would say looking for somebody that has a broad spectrum of people that are capable to care for you afterwards. It's not just a one-man show. So nurses, therapists, PAs, MAs, whoever's involved in your care should be kind of a team approach and to get you through the whole process. So I think that's important. Obviously feeling comfortable with what the surgeon's talking to you about as far as the surgery itself, his technique or procedure, your recovery, any of that stuff.
Totally.
Just have to like who you go to.
Yeah, makes sense. Makes sense.
So,
Well, sweet, Scott. Thank you so much for your time.
thank you.
Perfect.
Appreciate it.